All right, so today we've got something really interesting. We're going to look at two documents that, at first glance, seem like they're from completely different worlds. But I promise you, by the end of this, you'll see they are telling two chapters of the exact same story.
So here they are. On one side, you've got this report from Nepal about a training program for breastfeeding counseling. Pretty specific, right? And on the other side, a world away, is this very clinical guide to a severe childbirth injury called vesicovaginal fistula. One is all about proactive education. The other is about a devastating medical consequence.
So what's the link? I mean, how on earth do you connect a small community health training in Nepal to a highly technical medical guide? It seems like a huge stretch. But, there's this one powerful idea, this hidden thread that ties them completely together. And that's what we're going to unpack. Okay, let's start with the first document. We'll call this The Story of Prevention, an investment in knowledge. We're diving right into this training report. And what's so great about it is that it gives us this really clear, on-the-ground look at what it means to invest in knowledge before a crisis hits. So you see this number, 35. That's 35 healthcare workers from both public and private hospitals. And they were all brought together for one key reason: to fill what the report itself calls a critical knowledge gap when it comes to feeding infants and young children. A pretty important mission. And this wasn't just some afternoon seminar either. We're talking 3 full days. 3, from 8 in the morning till 4 in the afternoon, just packed with sessions one after another, all designed to build these essential skills from the ground up.
Okay, now for the money. The price tag for all this knowledge, just under 700,000 Nepali rupees for 2 of these training sessions. Now I want you to just kind of file that number away for a minute, because that number represents the tangible, on-paper cost of prevention. And trust me, it's going to be really important later.
You know what I find so fascinating is when you look at where the money actually went. It's not for some fancy, high-tech piece of equipment. Nope. It's for things like daily allowances, meals for the participants, printing manuals, basic, practical stuff. It just shows that the cost of prevention can be surprisingly down to earth. And they were really smart about how they put this all together. Day 1 was all about the fundamentals, right? The what, anatomy, nutrition. Then day 2, they got into the tricky stuff, the how, tackling common problems. And then day 3, that's when it all came together, with practical, hands-on skills, practicing right there in the hospital ward, from theory to reality, just like that.
And this right here, this quote from the report, this is the whole point. It says that sometimes the biggest obstacle isn't a lack of food, it's a lack of knowledge. Think about that for a second. So this training wasn't just a nice to have, it was a directed, targeted investment to fix that exact problem.
All right, so we've seen the prevention side of the story. Now we have to flip the coin. Let's talk about the cost of inaction. What happens when that kind of care, that kind of knowledge simply isn't there when it's needed most? This brings us to vesicovaginal fistula, or VVF. And look, there's no easy way to say it. It's a truly catastrophic childbirth injury. The guide is crystal clear. This almost always happens because of long, difficult, obstructed labor, especially when a woman can't get timely medical help. It is, plain and simple, a consequence of a system failing.
And it's not a one-size-fits-all condition. You've got simple cases, which are smaller and thankfully easier to repair, but then there are the complex ones. These are often larger, they're scarring, maybe from previous failed repairs. They're just so much harder to fix, which just compounds the suffering.
And the impact goes way beyond the physical. I mean, yes, the guide talks about constant physical discomfort and infections, but it also makes a huge point about the other stuff. The social withdrawal, the depression, the anxiety. It's an injury that doesn't just harm the body, it completely isolates a person. It's truly devastating.
So now it's time to connect the dots. We've got the investment in knowledge over here, and we've got the cost of inaction over there. So let's draw that straight line that connects these two seemingly separate worlds.
It's simple, really. They're two sides of the exact same coin. One document shows you a proactive solution in action. The other shows you the terrible consequence of that solution being absent. One is about building up, the other is about what happens when things fall apart.
And here it is, the big idea. You might be thinking, but the training was about breastfeeding, not childbirth. And you're right, but it's the principle that matters. The principle of investing in the knowledge of local healthcare workers. That same principle, applied to maternal care, is exactly what prevents tragedies like VVF. One document shows the principle at work, the other shows the vacuum left when it's not.
So why does all of this matter? What's the big takeaway here? Let's talk about the real power of knowledge.
Just read this quote for a second. It's so blunt, so clinical. The woman is wet all the time. It just lays bare the constant, unrelenting nature of this condition. And when you read that and then you remember that this is almost entirely preventable, it's just heartbreaking.
At the end of the day, this whole thing isn't really about breastfeeding, and it's not just about fistulas. It's about something much bigger. It's proof that a relatively small investment in people, in their knowledge, in their skills, can prevent an amount of human suffering that is just immense. And so that brings us right back to where we started, with these two documents. And it leaves us with one heck of a question to think about. If a small, quantifiable investment can prevent a lifetime of suffering, then what is the true cost of doing nothing?